In this video, I'm going to show you how to do the best exercise for Achilles tendonitis. By the end of this video, you will understand why your Achilles pain keeps coming back, how to manage the Achilles tendon pain, and how to do the exercise that will keep your pain away. If you have Achilles tendonitis, you may experience unexpected pain and cramping at the back of the ankle. You may have tried icing your ankle, soaking your ankle, even drinking more electrolytes. However, the pain just keeps coming back. It doesn't have to be caused by an ankle sprain or electrolyte imbalance. While Achilles tendonitis is considered an overuse injury, it could actually be a result of the weakening of the Achilles tendon. As the Achilles tendon weakens, it fatigues at a much faster rate, and this results in irritation, inflammation, pain, and cramping of the ankle. Short-term treatment of Achilles tendonitis includes icing, resting, massaging, and stretching of the Achilles tendon. To ice the Achilles tendon, use an ice pack or even a bag of frozen vegetables. Put the ice pack over the painful area with the contact layer between the ice pack and the skin to prevent frostbite. Let it sit for a couple of seconds or a couple of minutes depending on your tolerance. If the pain increases, stop icing immediately. You could ice a couple of different areas around the Achilles tendon. You could ice it on the inside of the Achilles tendon, back of the Achilles tendon, outside of the Achilles tendon, or even front of the ankle. To massage the Achilles tendon, use your thumb to gently rub the inside of the ankle. Gently rub the skin in this area because there isn't much muscle mass in this area. Here we are working mostly on skin and fascia. Do this for 10 to 15 seconds about twice a day. It would be a good idea to do this after you ice your ankle. To stretch the Achilles tendon, I recommend using a towel or a strap in the long sitting position. Hold the stretch for 15 to 20 seconds or longer if you can tolerate it. Make sure to stop the stretch when you feel increased pain. Again, it could be a good idea to do stretching after you ice if it is already inflamed. If you stretch an inflamed ankle, it could be pretty painful. To prevent the Achilles tendonitis pain from returning, you have to strengthen the Achilles tendon properly. To strengthen the Achilles tendon, we need a staircase or a small step. If you don't have either, you can use a phone book. I don't really recommend a stool. It could collapse on you or tip over, and that could be a safety concern. Step 1. Step onto the edge of the step. Have your heels hanging off the edge of the step. Slowly let the heel of the injured ankle down toward the floor into a stretch while holding on to the handrails or countertop for support. After your heel reaches the bottom of the stretch, use your arms to pull your body back up, and then slowly let the heel of the injured ankle down again and repeat. Do this for 10 repetitions and repeat for 3 sets of 10 repetitions. Make sure to give it enough rest in between each set. This exercise is called the eccentric strengthening of Achilles tendon. Once this becomes easier to do, you could let both heels down together. This puts a little more pressure on the injured ankle. The next level of Achilles tendon strengthening is, after you let the heel of the injured ankle down, use the strength of the calf muscles of the injured ankle and go into a heel raise from here. This way, we mix eccentric strengthening with concentric strengthening of the Achilles tendon. This essentially becomes heel raises on a step. To me, this is considered an intermediate level Achilles exercise. Once heel raises on a step becomes easier for you, you can attempt single leg heel raise. We still start with eccentric strengthening by letting down the heel of the injured ankle down off the edge of the step. You should still hold on to handrails or countertop for support. Next, push yourself into a single leg heel raise on the step. This exercise is essentially single leg heel raises on the step, and I consider this exercise an advanced Achilles tendon exercise. Once you are able to do 10 repetitions of single leg heel raises on the step without pain, most of your pain should be gone. Try to do 3 sets of 10 repetitions for each leg every day to make sure both legs and ankles are equally strong. You may still have occasional discomfort if you overwork your ankle or if you carry an excessive weight that you are not used to. Aside from that, you should have much less frequent flare-ups and much less frequent cramping. If you feel that this video has helped you, please hit the like button. Give me a thumbs up. I really appreciate it.